In order for you to be a physical therapist, so you need to work with people, so you need to help people. You want them to regain their movement, you want them to move better. I often tell my students that the cadavers will be their very first patients. That's the time that you can make mistakes. COVID-19 happens. They came to me and they told me, look, you have 1 week that you have transitioned all of your lab to a virtual environment. So everything will be virtually. Okay, there's no way because we have cadavers. We need to dissect them. We need to talk to the cadavers. But there was a way.
Going into the program, COVID was already prevalent in our world, and we had no idea how to be a hands-on profession in a hands-off world. Unexpected changes can impact us, but I think it's great that Dr. Sarmento was able to come up with a solution very quickly for us.
I came across this platform. Using this visible body, using this platform, I can create my own content.
So what's nice about Visible Body is it gives you this one simple template to look at. And you can basically add or subtract whatever systems that you're trying to analyze. So if you're just trying to look at the muscles, you can basically see the human skeleton with just the muscles on it. And then if you want to add nerves, you can add all the nerves and neurovascular complexes to that.
I saw immediate success. So students, they respond very well to it. They adapt very easily to the platform, and I was very impressed about that. Now we go back face to face, we have our cadavers back. That's great, but is there a way that I could integrate these virtual models with what I was having face to face? The answer for that was yes.
The newer students definitely get the edge with that because they're getting both. Beforehand, it was just the cadaver dissection. During COVID, just Visible Body was their main resource. So now Dr. Sarmento has really done a great job in integrating both.
Going into my clinical rotation this past summer, I ended up using my app almost every day. It's so accessible. That's the best part about it.
I wanted them to have passion for what they're learning. To develop this passion, you need to give them different tools. I think this passion will be reflecting to their services that they're providing to their patients.
We're giving you the tools to get out of pain and to get back to what you like to do, whether that's playing a sport that you like, spending time with your grandchildren, doing something that you love that makes you happy. It's something that's very meaningful to me, and that's something that I really think I'll enjoy doing for the rest of my life.